Give us 25 minutes, and our Lifeguard 2 AS-350B3 helicopter can transport a trauma patient from Frisco to Denver. Give us 45, and we can carry a critically ill newborn from Pueblo to the Children's Hospital in Aurora. Give us 50, and our King Air 200 can fly from Goodland, Kansas to the ground ambulance waiting at our Centennial Airport fixed-wing base. But no minute we spend in the air is more important than those we spend on the ground at your site. For the safe and rapid transfer of your patient into our care is step one in achieving the best possible outcome. Helipad safety starts with a secure site. If your helipad is at street level, be certain no pedestrians are walking through the zone and that vehicles are prevented from entering. Clear any debris from the designated area. And do not stand on the helipad or allow your co-workers to do so. If your helipad is at roof level, remove unsecured items and assure all maintenance workers leave the area. For both ground and roof level sites, keep bystanders well beyond the site perimeter. Monitor all access points at all times to assure no one enters the area. It's easy to develop tunnel vision while watching the helicopter land. It's also dangerous. Shift your focus to encompass the entire scene. Walk with caution. Never run near or onto the landing area. Stay at a safe distance until the helicopter lands. Do not approach the aircraft until the rotors stop and you are signaled by a Flight for Life crew member. Do not place or hold IV poles or bags above shoulder level in the landing area. And do keep a watchful eye on monitoring equipment at all times. For both ground and roof level sites, keep bystanders well beyond the site perimeter. You're probably familiar with hot and cold loading options. Hot, where the aircraft rotors continue to turn, and cold, where the helicopter shuts down and the rotors are stilled. One of the advantages Flight for Life helicopters offer is their extremely rapid engine restart time, just 60 to 90 seconds. So we can land, load, and return to the air far faster than most other air transport providers in our region. Given the safety advantages for your team, our crew, and most of all, the patient, a cold load landing protocol is employed when we are transporting a patient from a hospital or clinic setting. Here's what you need to know. Once the rotors have stopped, the crew will exit the aircraft and come to you. Do not attempt to help by opening the helicopter doors. If the landing area is wet or icy, walk with extreme caution. Communication is critical at this point. Be certain essential information is relayed as the patient is transferred into our care. Unless you are specifically asked to assist, allow the Flight for Life medical team to load your patient into the helicopter. When your role in the patient transfer is completed, please move away from the helicopter and behind the safety perimeter. Should you need to assist our flight crew in the event of a hard landing or crash, knowing and practicing this protocol may save lives. Remember to reach for red and push to stop. Shutting the aircraft down requires 3 steps. Step 1. Pull the emergency fuel shutoff toward the rear. This red lever is located either overhead or on the floor next to the collective. Step 2. Pull the start switch out and down. It's black and located on the ceiling or on the control panel. Step 3. If the rotor blades are still turning, pull the rotor brake. This will only work if steps 1 and 2 are done first. The rotor brake control is located next to the fuel shutoff, either on the ceiling or on the floor. Now, you can shut off the master battery by pushing the only red button on the instrument panel. It is clearly marked Master SW. Finally, turn off the oxygen system. It's a green valve located next to the pilot's seat on the floor. Overall, use extreme caution in situations such as these. Approach carefully, as some parts may still be moving rapidly and in a disorganized manner. If the helicopter has come to rest on its side and the engine is still running, spray water into the air intake and shut it off quickly. Finally, know your facility's fire suppression capabilities in regard to aircraft fuel and other flammable substances. This knowledge will be crucial if a hard landing does occur. Flight for Life's culture of safety depends on close and ongoing communication with partners like you. We welcome the opportunity to provide your care team on-site training. Just call our outreach coordinator. We invite your feedback on our service. You'll find us online at flightforlifecolorado.org. We also encourage you to follow up on the patients you assist through our secure website. On behalf of all of us, thanks for your time today and for sharing in our effort to optimize every patient outcome, every transport.